everyone, and welcome to another Manual Monday. Today we're going to be discussing plantar fasciitis. Plantar fasciitis is a painful condition of the plantar fascial insertion at the heel. It causes a lot of people pain, and a lot of people struggle with it. Typically you have pain that's worse in the morning when you first get up, that feels better as you get going. But it is one of those things that will chronically nag a person to death. So what we're going to do is talk about manual interventions and maybe some self-treatment techniques that you could take on yourself to do at home and help treat your plantar fasciitis. Alright, a hugely effective manual technique that we use is dry needling. So it's been one of our best tools in the clinic, and when it comes to the feet and plantar fasciitis, it is dramatic in terms of the results it produces for pain relief whenever nothing else seems to be working. So one thing we really like to do is we want to treat the calves, because obviously the musculature from the calf that inserts at the heel is part of the point of where there's a restriction typically that's causing the plantar fascia to endure more stress than it deserves. So what we'll do first is hit the gastroc medial head, and we got a twitch response right out the gate. Then we'll do the lateral head here. And we got a twitch right out the gate. Then I'm going to try to isolate the soleus muscle, which is the lower portion of the calf. Next, I'm going to hit the quadratus plantae, which is a muscle that supports the plantar fascia, and it has a common insertion. Now in this particular case, we're actually dealing with a lower extremity neuropathy, where there's also neurologic symptoms that are stemming down into the legs and feet from up the chain. I'm sure a lot of people have heard of neuropathy or radiculopathy. So in this case in particular, that's also part of the thing that we're dealing with, and also the thing that's getting improvement from this type of treatment. And we'll let that sit 5 to 10 minutes depending on the severity and the patient's tolerance to the treatment. Typically once it's going, they don't have any issues and they can tolerate it for extended duration. Alright, for step 2, we're going to do some soft tissue mobility, which is essential because you're thinking of what happens over time with chronic plantar fasciitis is the tissue actually becomes calcified and becomes leathery, and that attachment site becomes rigid. Well, it needs to be flexible, it needs to have it needs to be more like rubber, if you will. So what we're trying to do is think of stimulating the body to turn this leathery tissue into a rubbery, flexible tissue. So we have to do the soft tissue mobility in a way to help facilitate that process. So what we'll do is we'll put the calf in a bit of a stretch, and we'll put the foot up into more of a dorsiflex position. And then we're just going to use the edge of this tool to work not just the insertion, but the actual plantar fascia itself. And we're using moderate pressure. We're not trying to dig a hole or anything. But you gotta also assume that the tissue on the surface of the soles of the feet is going to be really rigid and thick. So you have to put a little bit of force in there to get it to actually do something. And it's important to remember the great toe extension and the flexibility of the great toe is actually an important part of this condition. If you don't have proper flexibility of the great toe, that stress is going to get translated somewhere else, and a lot of times the plantar fascia is the thing that gets targeted with that. So what we'll do is actually hit the tendon and the great toe area in order to really focus on making sure we're getting good mobility through that great toe. Where this is important is whenever we're walking in what they call terminal stance. The foot that's behind us, if we don't have good mobility in our plantar fascia, in our calf, and in our great toe, the heel elevates early, which puts stress somewhere in that posterior chain, in that chain of that foot. So you either end up with an Achilles tendon problem, a plantar fascial problem, or a great toe problem. One of the tools that we like to use to work on soft tissue mobility and to facilitate blood flow, but also to think of it as a way to decompress tissue, is the cups. And the way we're utilizing them today is in an active way, where we're actually placing the cups on the calf and then having the patient move into ankle range of motion, which is putting that calf on a stretch and then it's releasing the stretch. It's putting it on a stretch and releasing the stretch. And what that's doing is helping the tissue beneath the surface glide and slide beneath and free up some of the adhesions, and that's going to improve the calf mobility and increase her ability to move her ankle. And last but not least, the ice cupping massage, which is basically just a way to get some deep pressure and cryotherapy directly to the tissues. Again, this is the best way to deliver cold therapy to specific tissues and get the best penetration and the biggest difference to be made. And we could do this while we're actually stretching, so you're kind of combining techniques, and it's also going to help with some pain relief. The ice cupping also helps after needling, just because of the intrusiveness of having a needle poked into your skin. It actually really helps to prevent soreness, late onset soreness, and makes the procedure a lot more comfortable. Even though it's not they're fine filament needles and it's not very uncomfortable for the most part, and the soreness typically doesn't last for more than a day, it really does help to expedite that process and make that recovery time a little bit shorter. Alright, thank you so much for joining us on another Manual Monday in our Plantar Fasciitis series. I hope that really gave a lot of value to you guys, and join us next week for another Manual Monday. See you later.